Today we are come here or gathered for discussion of the breast cancer. Nowadays breast cancer is the number one cancer in the female, not only in Bangladesh, in the whole world. What are the risk factor? What are the causes of the breast cancer is? There is the multiple causes. One cause is the obesity, lifestyle, high protein diet, fat diet, early age of the menstrual cycle, late age of the pregnancy, and hormonal replacement treatment after the menopause. And another very important risk factor is the family history. Is there any family history of the breast cancer in the maternal side or cousin? It has a very big impact on the cause of the breast cancer, and they have the early diagnosis of the breast cancer in the family history patients. When we come to discuss about any cancer, the first comment is the prevention is better than cure. There are some steps how can we prevent the breast cancer. The number one is the lifestyle modification. And what is the lifestyle modification? It is compound with the balanced diet and healthy weight. Because in the first question, we discussed about the obesity and the high calorie or high protein intake diet, which can cause a risk factor for the breast cancer. And there is another type of prevention to detect the breast cancer in early. Who have the family history of breast cancer. And who have the family history of breast cancer, as they have, go for the screening, and we can detect early and ensure the cure of the cancer. We can diagnose breast cancer by multiple procedures. First of all, a patient comes to us with a breast lump. For that lump, we advise that patient to go for an ultrasound of the breast or mammography. After mammography or ultrasound of the breast, we found that the size, and it is only in the breast, only single mass or multiple mass. After that, we advise that patient to go for a core biopsy for the lesion. And if there any mass or palpable mass in the axilla by armpit, then we also advise that patient to go for a FNEC from the axilla. So we advise the patient to do a core biopsy from the primary lesion of the breast or primary mass in the breast and the FNEC of the axillary any mass. From that, we come out the histopathological report. And we all know that the breast cancer is a hormone-dependent tumor. So after the histopathology, we advise the patient to go for the hormonal test in layman language. So we go for the advice for the immunohistochemistry, which is combined with the estrogen progesterone receptor and HER2 status. And after that, we go for the metastatic workup of that patient. So what is the metastatic workup? It defines that the cancer is only confined to the breast or it is spread throughout the body. For that, it can be PET CT scan, can be the CT scan of the chest and abdomen, can be and compound with the MRI of the brain also. Or sometimes we also advise the bone scan also. After the staging and metastatic workup, we go for the treatment and staging the patient, which stage the patient is, and what will be her treatment modality. There is a multiple type of surgery can be done in the breast cancer. It can be total removal of the breast or also partial removal of the breast, and even nowadays we address the breast conserving surgery or breast oncoplastic surgery. And what is the breast oncoplastic and breast conserving surgery? It is the actual thing is that we make the size and shape of the breast is simple, only remove the cancerous tissue with a adequate margin and with the examine or axillary lymph node sapling. And sometimes people can ask me, is this better than the total removal of the breast is better than the removal of the cancer tissue only? It is almost similar. In some cases, only the cancerous breast tissue removal is better than the removal of the whole breast. And all sorts of treatment can be possible in Bangladesh nowadays. After diagnosis of the breast cancer, who needs the chemotherapy? It actually depends upon the staging of the patient. If patient is a good stage 1, hormone positive, after the removal or after the surgery, maybe need only the hormone therapy, not the chemotherapy. Chemotherapy, most of the patient who have the stage 4 disease or HER2 positive disease or triple negative breast cancer disease need the chemotherapy agent for the treatment of the breast cancer. And it's also solely depends on the stage of the disease. If it is stage 4, all of the patient need the treatment of the systemic treatment. It can be chemotherapy, it can be hormonal therapy, it can be immunotherapy, it can be targeted therapy. It depends upon the immunohistochemistry report such as ER, PR and HER2.